Why you don't care about your health. That's right, you don't care about your health. Get over it, admit it. The sooner you do, the better off you are. Because that way, you don't have to lie to yourself anymore. The reason I say that is from clinical experience, but also from just training and how we think and how we approach life. There are, I would say, there are two reasons that are more likely, more or less, to play a part as to why most people, including you possibly, why you don't care about your health. The first one, very common, is the state of overwhelm. When there's so much information out there, I mean, you could type up anything health related, from exercise to diet to mindset and stress management, all of it. There is an overwhelming plethora of information out there that is to the point where it just gets so confusing and just makes you want to throw your hands up and say, you know what, screw it. I'm just gonna do me. Which you can. It's just eventually something's gonna give. Something always gives. Unless you're that like 0.1% of the population. I think we all either know somebody or know someone who knows somebody who never worked out a day in their life, never ate healthy. They don't even, their body doesn't even know what a vegetable is anymore. They eat that and the body's like, what is this? A broccoli? No. And that being said, yeah, there are people who have that blessed holy genetics. And chances are you don't. Most of us, probably somewhere from late 20s, 30s, the luckier ones, 40s, things start to fall apart, start to break down, and then people take up an interest in their health. And that brings up the second reason. The second reason why people don't take up interest is because a lot of times when you don't have a problem, you don't have a health issue, you don't have a health condition, nothing's falling apart, it's kind of hard to really care. We're almost not designed to. We're just meant to go on and keep living. And our ancestors done it, but we can't do it any as good, just because there's so many other variables that get in the way. Everything from the processing of the food to the pollution to the chemical production. There are new chemical compounds by the thousands that get produced, that get created in a year. And our bodies are working overtime. You can't ignore it. I mean, well, you can if you want to, but eventually, the body will give in. And you couldn't ignore a symptom for so long. Eventually, it will wear you down. So that's the second reason. I think it is really common not to care. Now, I didn't have that luck. At the age of 12, I started having bloody stools and got taken to a doctor, misdiagnosed me, thought it was worms or something, got the wrong medication, got worse and worse till I was barely just skin on bone. And luckily, I managed to pull out of it, but that also created a very, very deep interest in health, like a very intense fascination. It's infinite. It's unbelievable. So I did go through chiropractic school. I got my doctorate in chiropractic, recognized by the state of California. After that, I took it a step further. I just went to a hypnotherapy college in Tarzana, and I got certified in hypnotherapy by the American Hypnosis Association. And that's because I think your mindset plays a massive part of why you do what you do and the decisions you are making. And when you make those decisions to change your life and how you're gonna fail, because let's face it, we have all done it. We've all tried to change something in our lifestyle in order to move in that direction towards more health, and then we just fail because when you're not, the truth is you're not in control. You're not. Your subconscious is. So I figured, hey, that's another tool I could add to my toolbox, and I was more than lucky to have my parents help me out through this, like to get me that extra step. So, like, subscribe, or don't, but I'd rather that you do, cause you know, likes, man. I mean, isn't that what life is really about? Everything else is just garnishing. All right.